welcome. I'm Dr. Ogan Gurel with the talk show Internet TV, Insights in Medicine, brought to you by InTimeTV. We have here a very special guest, Dr. Vedat Obuz, who will be talking about unmet needs in primary care medicine. I think it's a very good follow-up to last week's session that we had with Dr. Anderson Hedberg, with the former president of the American College of Physicians. And Dr. Obuz is a very special guest because he spans a number of areas. He is a practicing primary care physician in internal medicine and pediatrics. Did a internal medicine combined med-peds residency. He's also a medical device innovator, and hopefully we'll have a chance to talk about some of those innovations that he's designed to bring to the unmet needs in primary care as described. And he's also a health technology consultant. Dr. Obuz is medical director of the Lotus Medical Clinic and System in New Jersey. He's president and CEO also of MDM Healthcare Education and Research, which develops solutions that meet the unmet needs of the primary care physician of the 21st century. He came to the United States in 1989 as a postdoc and studied leukemia, so he has a well-published scientific background. And as I mentioned, completed Med-Peds residency at Albert Einstein College of Medicine in New York City. He visits us in Chicago, actually, from New Jersey. It's a pleasure to have you, Dr. Obuz.
Thank you.
And looking forward to discussing our topic for today, unmet needs in primary care.
It's my pleasure to be here in Chicago first time in my life, and I'm very much impressed by welcoming of the city and your show here. And to add to your introduction, just correction, the residency program was in Philadelphia, Albert Einstein. So
Albert Einstein, Philadelphia.
In Philadelphia.
Yes, right.
But I'm glad to be here following the footsteps of former president of American College of Physicians, Dr. Hedberg, because a lot of things he has mentioned in your program last week has a lot to do what happens in my life, in my practice day to day, and a lot of things that is happening in the lives of many practicing primary care physicians and who are facing the same difficulties as well as challenges. And I'm here to actually represent and bring my viewpoint and then some of the solutions I am working on, and with the help of other physicians and the probably hopefully some venture capital we can raise, we will help for the better care of primary care in the United States. As you recall in your last week's program, that Dr. Hedberg has said that primary care is in crisis. Indeed, it's in crisis, and
Yes.
and I've been practicing since 1996 as a Med-Peds practitioner in state of New Jersey, and I have had not seen actually so far that any rectification in the current existing problems.
Right.
And as you know, is that diversity problem is 46 million uninsured, is getting increased every day, is a big challenge. We have to find a solution to deliver a better health care and reduce the cost of these people when they become very ill at the shoulders of states and their Medicaid programs. Also, quality of care has to be improved because we have great medicine, the best medicine in the world in this country. We have the knowledge, and as Dr. Hedberg has stated, that we cannot even apply the 50% of the knowledge we have because we are overwhelmed. Also, cost is a big issue, and we have to find ways of reducing the cost while improving the healthcare delivery system. And my companies, including my day-to-day practice, has been working on several aspects of these challenges, and I can simply start with healthcare technology implementation and innovations. And innovations, again, and has to be brought into day-to-day practice of primary care physicians, because it's been shown over and over that it's better coordination of care, also implementation of new outcomes in measures, as well as reducing errors by applying electronic healthcare recording system will reduce the cost
So
tremendously.
some of the technologies and innovations you're discussing are not just clinical devices, or as well, there's also the information technologies as well.
Yes.